Odin presents Real Talk for Nurse Educators, Interrupting Incivility. Real Talk is designed to create space for honest conversations about the challenges facing nursing education. The views shared in this episode are those of the speakers and participants and do not necessarily represent the official position of Odin.
Hi, friends. I'm Dr. Nicole Heimgartner, and I'm here today with Dr. Sherry Rebar, and we are here for Real Talk. And this is part two about really addressing incivility. And we're so excited because we have new friends here today to interact with as we just have this real conversation about how to address incivility in nursing and academia. And we're going to kind of recap what we talked about in our last session and then really move forward into some tangible things that we can all do as nurse educators. But first, let's everybody introduce themselves. So, Sherry, would you want to introduce yourself?
Hi, I think you probably know me by now. I'm Dr. Sherry Rebar, and I am thrilled to be here on Real Talk. Dr. Franklin, would you like to introduce yourself?
Sure, thank you. I'm Dr. Sonia Franklin, and I'm a Dean of Nursing at Jersey College. And I've been in nursing education for over 16 years, and I love what I do every day.
Awesome. Dr. Smith.
Hi, I'm Jennifer Smith. I am a professor of nursing at Harbor College, which is just outside of Chicago.
Great. And Dr. Fontaine.
Hello, everyone. My name is Claudia Fontaine. I am an associate professor at Daytona State College teaching med-surg, and I've just become tenure maybe last year.
Congratulations. That's wonderful.
We are so glad to have you all with us today. And, as we've said in the past with Real Talk, the more voices that we can bring into to the conversation, the more real it becomes. And boy, we had so many comments and just chat through our last discussion where we really started digging into incivility. And so I'm just going to recap a little bit, a few of the things that came out of our last discussion, which was really that we all have a role. And I think incivility is just one of those things that's hard because it's another hat that we have to wear, and we're wearing a lot of them as nurse educators anyway. But we tend to look away and let things happen. And we've gotten to a point where we can't do that anymore because we're seeing incivility in our classrooms. We're seeing it, between students, students to faculty, faculty to faculty, nurses in clinical practice to faculty to students. It's this cycle that's happening. And it's one of those things where if we don't address it and we don't start addressing it in academia, where's it going to go? It's going to go into practice. And then it's going to just keep on and keep on. And so we're at a point where I think it's really, really critical that we all own the role of addressing it. That doesn't mean that we all cause incivility, but it means that we all have a role in how we address it. And so we talked about a lot of different ways that incivility shows up. Some of it is subtle, in microaggressions and in behaviors in classrooms, and we identified some of those. So if you haven't listened to that last Real Talk, go back and take a listen to it. In this Real Talk, what we hope we're going to get into today, and I think we will, is just some really specific ways that we can all move forward to address in academia the idea of how do we stop incivility and address it before it ever even occurs. And we talked a lot previously about professional comportment. And one of the things that Sherry and I have talked about at length is the need to have professional identity and professional comportment integrated into program outcomes and course outcomes from day one in every nursing program at every level. I think a lot of times it becomes an afterthought. And what happens is then we get nurses in practice that are brand new that don't want to orient. And Dr. Smith, you shared this exact example with us just a moment ago about, a nurse not wanting to take students to work with on the unit not really recognizing that part of our professional role and identity is to help nurture and mentor our profession. And we all have a responsibility to do that. So I think I just kind of open it up from here and let's just talk together about what are some tangible ways? How can we move forward in this? Sherry, what are your thoughts?
Well, a little bit earlier, we were talking about knowing your own self-worth. And I think everything that we intervene with starts with knowing who we are. I think it's very important that as nurse educators, as nurses, and that we instill in nursing students is that we do have to understand our responsibilities. We have to know our self-worth. We have a right and a responsibility to shape the profession of nursing. We are no longer just preparing nurses to go stand at a bedside. We are preparing nurses to change the health of a global population. And your global population might be right in the back door, or it could be on the other side of the ocean. We need nurses that are going to be able to go to diverse places and be able to care with their heart. And part of knowing that is knowing who they are and the value that they bring, not just for their hands-on skills to the bedside, but in their ways of being. One of my favorite phrases for just about anything is what we allow is what continues. And if we do not recognize that we need to instill those kind of values in our students from day one, there's no time that they just flick a switch later and all of a sudden become professional, all of a sudden have comportment, all of a sudden are civil. We have to address it from the very, very beginning. So that's part of what I think we would like to talk about today, but also making sure we get into those very specific strategies because there are questions. And I know there was a lot that came out of the last conversation was how do you de-escalate? How do you handle it when people are literally bullying each other, whether it's faculty or students or nurses on the floor? What do you say? How do you say it in the moment? What do you do with somebody that's like, not my fault. I didn't do anything in civil, but yet you know that they really did because we've all witnessed this. I can go back as early as my own nursing school, and now I have a word for being able to identify what that behavior was. I didn't necessarily know back then, but I thought it was me. But it's not me. Sometimes it's just incivility that needs to be addressed. So that's kind of our platform, I think, for today. And where we start is we have to own that ourselves. We have to know our voice matters. And we need to know that what we allow is what continues. So I think if people go away with nothing else today, they need to know that not only do they have that responsibility, but they have that accountability to be able to do that. So how about we talk a little bit, Dr. Franklin, I think you
Yeah,
had some input on that too.
absolutely. So, I know you weren't with us last time, but I will say that that has been my mantra, that if we allow it, it's going to continue. And so one of the things I shared in the last session was that on my campus, I set that tone with every student and with every faculty member I hire that I will not tolerate it. And I know the literature talks about zero tolerance policies not being effective. However, I do disagree with that. I think it depends on the way that the policy is enacted, like most things, and if it's just a top down approach that people can't buy into and see the culture behind it, I think then, yes, it's more than likely not going to be. But I see incivility as a tenacious weed, and we have to get in there and prune the heck out of that thing and get it gone. And that has been my driving force since I became a nurse educator and now that I'm in a leadership role, I feel like I can stand behind that even more. And I have tried to role model that throughout my career as an educator, but now I'm trying to show the next generations of leadership, of practicing nurses. I want everyone to kind of buy into this at the same level so that we can go in and make changes in the facilities and across the country and countries, where these student nurses will eventually go to work. But I just feel that down to my core. And I just wanted to say thank you because that resonates so much with me.
I believe that it is a culture change that takes time. So often we like a quick fix for things, and this is something that is not going to be a quick fix. It is proliferative within our profession. I'm very sad to admit that, but I think we're also putting our head in the sand if we don't. But if each of us make a difference, as you just mentioned, in our own little area of domain, that is what enacts change. Grassroots efforts are usually the most successful things when they pick up steam. And it starts with making a difference with every student, every faculty, every encounter, every time. And we hope that we bring that, or they bring that, to the bedside with their civility with every colleague that's a nurse, every patient, every healthcare provider, every time. But it is going to take time because we have other dynamics that are also affecting people's responses to things. We were talking earlier about how that, we graduate students, and if you've been out for 6 months, you're a charge nurse. You know what you're doing, and you are now educated. And it's because we have so much turnover and we need so many more nurses. So there's frustrations that also fuel some of this, that we have to address that perhaps in a little different way, even though it's incivility, than just someone who's just being nasty for the sake of being nasty. There's a lot of dynamics, but the place that we start to address it is to not let it start in the beginning. So I
Right.
appreciate that when we are working one-on-one with faculty and students at academia.
Right.
One thing that we do in our program, one of the first semester professors was just seeing an increase in incivility with her students. I think, we've all noticed that students are changing. She developed the incivility policy. So now we have a policy that says this one thing, like sleeping in class, is incivility. And then it'll go down each, just as it gets. So I think the last thing might be like screaming in class, or screaming at your professor. And it talks about what's going to happen if you do each of these things. But I think that it's wonderful that she added this policy because it gives us a point of, okay, like, let's talk about what your scope of practice is, right? Let's talk about what's appropriate, what's professional. And I really think that it helps the students understand that not only will this be tolerated in class, is not also not appropriate for a professional nurse.
Exactly. And there does have to be something with consequences. We are always free to act, but we are not always free from the consequences of those actions. And that same thing is going to take place in professional practice. You can also choose your behaviors, but the consequences are there. And I appreciate what Dr. Fontaine said there, is that it says, if you do this, there is that. Now, I'm sure there's always a degree of interpretation that must be looked at because, again, we're human, we're dealing with the human dynamic, but your actions do not free you from the consequences that may occur. And it's not retribution, it's consequences of your actions.
It also clarifies what is respectful and disrespectful, because students, especially in a generational standpoint, students in a different generation, something I may perceive as disrespectful, they don't mean disrespect by it. For example, if they're playing a game on their phone, I'll be honest, I'm always usually doing something, and it doesn't mean that I'm not paying attention to you. It's just how my brain works. But for me to perceive that as being disrespectful when that was my last intent. So I think that is helpful when we have policy and when we have these discussions up front, so that we all understand behaviors that are okay and that are not okay. If a student wants to knit in class, knit on, if that helps you focus. If that's on the student to understand. That's the only place where I get a rub sometimes with policy, when it becomes so prescriptive that it's the professors, I want it this way, as opposed to evidence shows us, and our A&A policy on civility says these are the behaviors that are incivility. But I love when we have policy that we can fall back on, because that way it takes the subjective piece out of it. It's not Nicole says you can't do XYZ. It's our profession expects this. Same thing when it's embedded into the course outcomes. It's not about what an individual faculty or professor wants. The course requirements are. So it takes that level of subjectivity out of it, and it makes things more objective, which take that feeling component out, which can automatically lower the chances that you're going to have incivility or pushback. because it's not a personal thing. You take a lot of the feeling out of it when it becomes more objective.
It's
So,
just like just culture.
yes,
It's
yes,
exactly like just culture. Did the student or did the faculty have an obligation to produce an outcome or to align with a behavior? And if the answer is yes, then we move on. If no, we coach and redirect. But it's not about the outcome of their behavior. It's about the behavior itself. And it sounds like what Dr. Fontaine has said that hers are or the programs is very targeted to some very blatant behaviors that we can all agree not okay. And again, some of this stems from differences in students now versus differences in students 10 years ago, 20 years
correct.
ago, and the world they've grown up in. They're very comfortable behind a screen. They're very comfortable with very informal communication, and they have a different level of entitlement. I see this, at least in my nursing education practice, that requires different strategies, which part of it must be prescriptive, but I absolutely agree there are certain things that sometimes faculty get a little too overbearing on. Well, I'm not going to let them have their laptop out in my class. Well, goodness, maybe they're taking notes on it because they can't read their own handwriting, and that's me. I have to do that. Maybe they are doing something that helps them fidget a little bit because they can't focus otherwise. That kind of stuff I just am going to confront later if I see a trend in grades or if they're disturbing someone else. But I love the knitting example. As long as they're not disturbing somebody else, then knit away. A lot of times doing with the hands helps engage the brain.
If I could just add too, though, I think an element of this, though, that is important for the students to understand is self-reflection. And so I know we've moved away from critical thinking and more towards clinical judgment, but what I do like about critical thinking is recognizing that there are different perspectives. And so one of the things, to your point earlier about students playing games in the class, that might be how they process information while they're in the classroom. But I think we also owe them the opportunity to share with them what a different perspective of that might be. In
Mhm.
that you can make the choice to do that, but please also understand that there are going to be some people who perceive this in a certain way, so that they can
Absolutely.
perhaps be more self-reflective about how their actions affect a team dynamic, how their actions affect an interaction with a patient. I mean, all of the choices that we make to behave in a certain way affect our relationships with those other people.
It's the principle of read the room, and really understanding what's happening around us, and being aware of that. I have two older teenage daughters, and that is a phrase that I use constantly. Read the room, friends, like what's going on around us here. And so I think that that's something that we have to talk with our students about. And that takes us full circle back to that needs to start from day one in our expectations and professional behavior and professional comportment. And, one of the things that we kind of talked about was the idea of role play. And we do a lot of role play with our students. But we as faculty also have to have that cognitive rehearsal as far as how are we going to respond in the moment, either in our classroom when we're faced with incivility or in a faculty meeting when we're faced with incivility. How are we really going to respond? But one of the things that I want to address quickly is we had a few comments of you're never going to have everyone that agrees. And I just want to be really clear that you can have dissent, meaning not everyone agrees, and have civility.
Yeah,
Having dissent is not incivility, and role modeling that for students and faculty alike is really, really important. Sherry and I work with faculty groups a lot, and we'll say, first of all, decide is this the hill you're going to die on? And second of all, realize that we're going to come to not a
consensus.
consensus, not 100%. You're not always going to agree with everything,
Yeah.
but that is not incivility. It's
Right.
behavior that drives that. So
Yeah.
I just want to make sure that everybody understands that in even conflict is not necessarily incivility.
Correct.
Conflict can be good. We mentioned that in our last real talk that if everybody agrees with everything and it's, a kumbaya session, then you really risk that process of developing groupthink where everybody just agrees with everything because so we can get done quicker, right? And that doesn't serve anyone. So I just want to be really cautious with that, that you can be assertive, you can be clear, you can stand on evidence.
Right.
That brings some conflict and it may bring some discomfort, but that is not incivility. Let's say, Sherry, I'm going to be the student and I am in your class and you're teaching and I'm just talking. I'm talking. I'm doing whatever I want. I am talking. Actually, you know what? I'm talking on the phone. Somebody just called me and I'm talking on the phone and you're giving a lecture. Hey, yeah, what up? What's going on?
All right.
Really?
In a case like this, I would need to stop for a moment, make some eye contact because, I think that's important. And I am I am not opposed to calling the person out on the behavior in a very professional way. I would say, Nicole, I see that you're on the phone. Could you kindly step out while you take that call?
Oh, it'll just take a second.
I still need you to step out.
For
Thank
real?
you. Yes, thank you for stepping out. And we're just going to pretend she goes along with that. Now, does that sound kind of a little weird? Yeah, maybe that's not exactly the case that you're going to get. But again, that's not incivil of me to call that out because she's affecting everybody else within the classroom like that. She should have more situational awareness to know that that is not the place to do that. But also, I think that's role modeling for the rest of the students that not everybody can just do what they want to do in class without it being called out. Was I rude to her? No. Was I clear? I need you to step out. Now, would I address that later with her individually? Yes, absolutely. But in the moment, I'm not going to be rude to her. I will give you a funny example that actually was just like that. I had a classroom of about 80 people, and I had two girls sitting like three-quarters of the way back, filing their nails with all of their nail stuff out. And they brought out their hands like this and started filing their nails, which again, I don't care if you file your nails, file on, as long as it's just something that is under the table. Maybe you've got a hangnail. I don't know. But they were set up like they were at the salon. And so I just, once they got themselves set up, I just very, calmly said, so and so and so and so, I'll need you to take that outside, please. And the answer back was, what do you mean? And I said, I will need you to take your nail salon outside and you can rejoin whenever you're finished. And it actually, I see a little giggle here. It literally was a little bit of a giggle, but they did. They went out, and I think they were embarrassed. That was not my intention. It was simply to interrupt the behavior and redirect to what needed to be happening in the classroom at the moment. But at this moment, both of those, I'm going to call them ladies because they are 20 years a nurse now. That's how long I've been teaching. One of them is a missions nurse, and the other one, I think, is a pediatric nurse, just doing great things. All it was just redirecting in the moment. They were very young at that time, chronologically as well as in maturity. And it was just a redirection. Just, I need you to take that outside. Not mean, not inappropriate, just clear, factual. Now, could I have had Nicole push back on me further? Yes. And again, I would have to read the room at the moment to know what I would exactly need to do because my response might be different depending on what else is happening, who else is involved or not involved, what eyes are on this. We have to adapt in the moment, right? Nurses, we adapt and overcome. So we have to adapt at that. But my initial thing would simply be to say, Nicole, I'll need you to step out while you take your call. She might be taking a call about a child that's ill at school. It could be a family emergency. It could also be her boyfriend. I mean, really, that part is not my business. My business is interrupting the behavior so we can continue learning and also directing her to an environment where if you need to take it, it's out there. And then we'll talk later about how to handle that in the future.
I think we are always so afraid of calling out a student in front of other students.
Sure.
And that is one of the things that maybe in our head as we're thinking, how am I going to address this right now in the moment? That's that conflict. But to your point, I think it is important to recognize that we are role models for
Sure.
what the behavior is.
And we're
And
not shaming them. You know, that
exactly.
moment, that was not a shaming thing.
And it really shouldn't be seen as a problem by labeling it as inappropriate, because it's inappropriate for this space right now.
Right.
It's definitely inappropriate behavior in another place, but we're in the classroom. So that
Exactly.
is usually my go-to when something like that happens, is
Yeah.
that's not appropriate for this situation.
Right.
And then, either redirect the student or tell them that they need to stop doing that right now, because that word inappropriate helps kind of reframe it for the student to understand that
It
in this
does.
space, I need to do these things.
Right.
And I could do this thing in another space.
Over there. Right. And that goes back to me knowing who I am, knowing that my voice matters, knowing that I have a responsibility, not just to that student to not shame them, but to the other students in class to provide the education that they're all paying for. So it's not going to be about me. You know, it's not like I'm going to take that like she's taking a call because she hates me. Often, we will find that sometimes educators are like, well, they're doing this because of they want to get back at me, or they don't like my class, or this or that. While that may be the case, we have to consciously separate ourselves from that,
Right.
because we will respond very differently if we don't.
Right. And I just want to empower all of our faculty educators. I think one of the things that is scary when students, more than one, will come at you about this test wasn't fair, or these questions weren't fair, or, how are we supposed to do this? And in the moment, that can feel very personal and it can feel very overwhelming. And one phrase is, I'm not going to be discussing that right now, but you are welcome to make an appointment with me. That's it. They
One
can
on
say,
one.
yeah, and that's the other thing. You meet with students one at a time. You do not speak for a collective, you speak for yourself. And so do not be afraid. Do not feel like that you have to stand in front of a group of students and let them pick you apart because they didn't like the test. You do not have to do that. First of all, that's uncivil behavior. Now, they have a right to ask questions.
Totally.
This is where we fall back on policy. What is our exam review policy? How do you contest a question? Those type of things. And you might say that if you feel very strongly, you can contest a question using our process of XYZ, but I'm not going to be discussing this any further right now. You all know how to make an appointment with me one-on-one to meet, and I'll be happy to talk with you moving forward. And I just want to empower faculty. You don't have to, it takes it, if you don't engage with it, it doesn't go further. It doesn't go further. Now they can try and they're going to try,
Sure.
but you can
I think a
also,
lot of times they come though with friends because there's safety in numbers.
yeah,
Sometimes they just don't know that they need to know themselves and speak for themselves. Now, there are the nasties that will get in a little group and then it's try to, mob mentality, but that strategy works either way. You're role modeling to speak for yourself, to make an appointment, to follow the policy, and you're also not engaging with the mob, so to speak, that maybe at that moment have an axe to grind. Again, what we allow is what continues. If we don't allow it from the beginning, we have a process for them that they can follow. That's a professional process, that's a civil process, and we restate that and we stick to it. What we are allowing then becomes hopefully what continues for good.
I wonder if Dr. Smith could share about, we talked about a cognitive rehearsal. She mentioned that there was a nurse on the unit and they didn't want the student. I just wondered if she could just share what she
Yeah.
said so we all can use that tool, because I wrote it down and I think it's amazing.
Thank you. I knew it's happened. Practice makes perfect. I'm still working on it, but it has happened so many times that now I have it in my pocket of go-to phrases. When I get to the unit and a nurse says, "I'm not taking students," or we walk on the unit as a group and they're like, "Oh, students." So I will say, and sometimes humor helps to soften it a little bit, but I will say, now, how are we going to get more nurses to go into the field of nursing if this is how we are greeted with these new nurses who want to become nurses? I'll say it like that and try and make it lighter. But sometimes I've had to have more frank conversations, specifically with the individual nurse, But and in respect to one of the things that you mentioned earlier too, in just asking the person how they feel, as you had said, if you want to also share a little bit about that experience, because that helps to kind of reframe it, the interaction, not just with the group, but as the individual. I feel very strongly about the fact that we as educators are role modeling constantly, and we are always having an audience of students who are watching how we behave and how we respond to incivility. So we have to address it in the moment so that they can see that that is the way we make a change for the future of
Right.
nursing.
Right.
You've also given a great benefit of the doubt to
Yeah.
the nurse that maybe is having the moment, whatever the moment is. None of us are immune from having a moment. Sometimes we know we're having a moment and it comes out. Sometimes we are having a moment and we don't realize that the way we said something or our body language communicated something that we didn't want to. You've given the benefit of the doubt either way.
Mhm.
And I really like that you said that you approach it from one angle, and then if that's not how it's working out, then you can approach it from another angle. And giving people the benefit of the doubt is the important thing from the beginning. And I think they also come to respect, hopefully, that conversation. You know, Nicole and I have had many conversations with each other over the years that sometimes is like, you're having a day. I need you to reel that back in. But we know we are each other's safe space as colleagues, as friends. It's a little different when you don't know that person
Exactly.
in that
Exactly.
capacity, but remaining objective. And we always talk about that to students, right? You know, remain objective. If they tell you something that's kind of shocking or different from what you believe, you remain objective. It's the same thing when we confront incivility, whether we're doing it peer to peer, in a group, with students, with a nurse on the floor. We have to remain objective and how that looks. And I think that again goes back to knowing that that is within our role and scope of what we are expected to do as professional nurses.
And if I
Right.
could just add too, sometimes I find myself, I mean, because we are human beings, so we say things that might be perceived in a way that we didn't intend them as well. And so I will say that to the group of students in my
Absolutely.
classroom. I will say, you know what, I just heard myself say that, and I realized that it might be heard as this, and then
Yes.
I will reframe what I said, or I will try and rephrase it so that, or provide clarity to what I actually meant.
Sure. Yeah,
And
there's
Because
there's
my
nothing
hope
wrong
is they
with
can do the same. Yeah.
right.
nothing
There's
wrong with apologizing if you realize that you've done that. And I think that is a lot of character that's shown.
absolutely, absolutely. They need to see that in us. And in the clinical unit, they need to see that. You know what? I snapped at you, and I shouldn't have. I was overwhelmed because I'm just that's my not that I snap at people, but if there's a whole bunch of stuff going on at one time and then you come up and you ask me, "Hey, can I have a piece of gum?" or, like something, and I'll be like, "Leave me alone," like, and so I'll go back, "I'm so sorry. I didn't mean to snap at you. I had so many things going through my head at the time, and it had nothing to do with the fact that you came up to me, and I apologize, but that role models to the student what civility and professionalism looks like, and Sherry and I have the benefit of working with each other for I don't know 100 years, and we can tell each other, "Girl, sit down," and and
And
we
girl
know
sits down at that moment.
exactly, and we know. But when students are learning that, it's really important. So I think a way that we might be able to wrap up, I got two ideas. One idea I'd like to do, if y'all are game, is to do a fire hose of phrases.
I
So
think
if
that's
we can
good.
just kind of go around and we don't have to be in any particular order, but as you think of a phrase that is a really tangible phrase that you can use to diffuse, to address incivility as it's happening. And this is another key point too. It doesn't have to be happening to you because a lot
Right.
of times in faculty meetings, you got two people going at it, and then there's a whole other group that are just sitting there watching it happen,
Yeah.
So how do we address it? How do we stop it? So let's do, like, we call it the fire hose of ideas, and just see if we can throw out some ideas. And then I have a couple things from, of course, the incivility guru, Dr. Cynthia Clark, that I think we can wrap up with that may give us some really good food for thought, and that will certainly launch our discussion when we do our watch party. All right.
Sounds good.
All right, so I'll start with a couple
Okay.
questions. A lot of times, I used the example last time of asking a question to kind of push back on that. I'm sorry, can you repeat that? That does two things. It changes the brain because you ask a question and it forces the person to say again what they just said. Most of the time, they'll reel that back and maybe say it in a different way. Sometimes they'll double down and then you have to address it. But that phrase is one that I always keep in the back of my mind. I also will use the phrase, how can we move forward constructively? That's especially if tone is getting, kind of ugly or it's becoming more personal as opposed to being a factual discussion. Like we're crossing that boundary from being a conflict good discussion to becoming an in civil discussion. How can we move forward constructively? So, what else you got?
I like to actually call the behavior as it is if I need to. Sometimes there's the gentler approach that works. Sometimes if the gentler approach is not working, I will say something like, it's clear by your conversation that you're frustrated.
Mm,
And that hopefully draws it back to that. Sometimes that's more helpful with faculty to faculty or leaders and faculty, but even with students, it's clear you're frustrated. We're going to name the behavior. Let's step back and take a look at this from a different vantage point.
mhm,
And then hopefully, again, that resets the brain. And most people that I have seen that have been on the receiving end of that, it is a reset.
mhm.
Some people like to behave in a certain way until that it is addressed. And then that is when they will stop the behavior, but they will keep going with it as long as they can. That's where we get the phrase from people that are like, oh, that's just how he is. Oh, that's just how she is. We don't want that. It's okay to name the behavior and say, let's step back and rethink this, or let's look at this from a different vantage point, or maybe we need to pause here and reconvene. Any of those things are like tails to it's clear that you seem to be frustrated at this moment. But again, the way we deliver that is critical. It can't be accusations, it can't be shaming, it simply has to be objective. So that's my input to that.
One phrase that I use whenever there's a situation escalating or becoming incivil is I hear you. I hear what you're saying because I feel like most of us just want to be heard when frustrations occur. And that's how things kind of spiral out of control sometimes. And that's just basic therapeutic communication, like we referred to last session, that's kind of where all of this really should stem. But I feel like that's one that works pretty well in almost every situation. It's just letting them know and then restating, rephrasing, all those basic skills that we know.
I usually like to go to timeout. I know it buys me a little time to pull together what I'm going to say. And it's a quick intervention to, again, like regroup a little bit. I also, there were a couple things that we talked about earlier related to help me understand. That's definitely a phrase that I use quite a bit. But I also will share with them what I'm feeling at the time. Like, I don't believe this was your intent, but that came out in a way that was, hurtful or whatever it is, or didn't seem to be supportive of the team dynamic, or in whatever audience I'm working with. I do slightly change that, but I think it's important for the person to understand the impact of what they said, in addition to taking that break of rerouting the conversation.
I think that's a great thing. And I think it's important that we also pull out the ANA Code of Ethics to be
Mm,
able to talk with students about that, because there are provisions in there that says that it is our responsibility to collaborate with other nurses by listening, demonstrating mutual trust and respect, facilitating transparency, and engaging in open communication. That's straight out of the code. And so
mhm.
again, this is not just Dr. Rebar that is bringing something to your attention. This is the profession that you
Right.
are entering. Or if you're a faculty member, this is the profession we are part of as colleagues. Dr. Fontaine, do you have any kind of special phrases you use that help work?
So first, I just am enjoying you calling me Dr. Fontaine, and I need to go apply to a doctorate program as soon as possible. But yes, I
To
do.
be Dr. Fontaine. I'm so
Thank
To
sorry.
you.
be.
Yes.
Thank you.
Love it.
So a couple phrases that I'll use is how are you? So sometimes I found maybe a student will come in my office and they're standing up and I know my mother, since I'm 6 foot, my mother has taught me like you need to sit down when you're talking to somebody because they could just feel overwhelmed just by my height alone. So I'll sit down, they'll come in my office and I just say, how are you doing? And then that might give them a chance to talk about the things that may not be what I'm seeing right now, but maybe something that they brought in from home, or maybe something that, a student offended them. Another thing I like is silence. So that kind of goes with that as well. Just sitting there and listening, because just like Dr. Franklin said, sometimes they just want to be heard, which is a very common thing. And I love that you mentioned we can even practice making sure that we're prepared to deal with incivility, even with our faculty. So I think if it's during a meeting, I'm thinking, I love that you mentioned this. How can we go forward with this? So just kind of giving them like some positive, I'm rooting for you, but we still need to move forward.
Absolutely. And I
That's
love what you
great.
said there because often with our students, when they come in, the issue isn't the issue.
No.
They come in, they're coming in hot with something, but if you just listen, it's something else. I
Yep.
also love that you're reading the room with body language because I'm like all of 5'3", so I need to stand on a chair. But that is important because there's power dichotomy with faculty and students no matter what. Just because
Exactly.
they feel that you hold the keys to their progress and graduation, where we know that if we're doing it right, we don't hold the keys, they hold the keys. We simply evaluate and they still are eligible to earn everything they can earn. But that power dichotomy of our body language, of our sitting or our standing, even a desk in the middle. When I was a director of nursing, I positioned my desk in such a way that I would turn to the side and the chair was over there that somebody sat in. So I don't speak to them across a desk, which infers that I have more power. Those little things can mean a lot when we are addressing incivility. So I appreciate that you mentioned that too. I think all of these are great phrases. They're not a catch-all,
No.
but they sure are some beginning phrases that I do think are very useful to help. And with that, I think we need to probably wrap this up for
Yes,
this
we do.
time.
We do. I want to let end with just a little bit from Cynthia Clark, because I think this is a question that we can all think about and that will lead us into some great discussion after our watch party. So recently she was asked if you could give one piece of advice to students, educators, and leaders about creating civil environments, what would it be? Her answer, again, this is Dr. Clark, said, lead by example and cultivate self awareness. Being more self aware is one of the core competencies of civility. Ask yourself, am I adding value to this environment or detracting from it? Wow, what a question.
Powerful, powerful
Powerful
words.
question. Ask yourself, am I adding value to this environment or detracting from it? Then she goes on to say, and don't be afraid to ask for help. That increases the potential for success. Also, never underestimate the power of relationships. If not us, who? And if not now, when? Wow. I mean, to kind of end on that thought, and I think that will really give us a great launch pad as we have our watch party and get all of our friends together, because we know that all of our brains together are far better than just one of us. So I can't wait until the watch party and until we can continue to unpack this. And I just want to thank our special guests for being with us with this real talk. And we will see you all soon.
Thanks, everyone.
Bye. Uh-oh. Think she froze.
I'm frozen.
Yes, you're frozen.
You're
Am I
back.